A renowned epidemiologist and public health physician says an audit of managed isolation protocols is not enough to ensure the system is safe. The Prime Minister says the 2 new COVID cases represent an unacceptable failure of the system that should never have happened and cannot be repeated. Jacinda Ardern's called in the Defence Force to oversee all quarantine and managed isolation facilities. The Assistant Chief of Defence, Air Commodore Digby Webb, will also audit all existing systems and protocols and will make any changes needed to strengthen other border controls. Otago University Professor Sir David Skegg was an expert witness at the Epidemic Response Committee, and he joins me now live. So, David, you were listening to that interview with the lady who was in isolation. Does that sound like a tight ship in terms of management of isolation?
No, it doesn't, Lisa, and I have been concerned for some time that our procedures may be lax. I'm delighted to hear that Air Commodore Webb is going to be monitoring adherence to the protocols at the border and in quarantine and isolation. But I don't think that's enough. I think we also need to know that the protocols are all fit for purpose. So I believe that we urgently need an independent review of all the border and quarantine arrangements. And by the way, that's not just at airports, but also at seaports. I've been concerned to hear about crew off ships wandering around Port Chalmers and Dunedin, even going to healthcare facilities. Have those people been tested? I doubt it.
So is an audit by a Air Commodore, do you consider that to be an independent review, or who should conduct it?
No, I think Air Commodore Webb and the Defence Force are very well placed to review the logistics, to see whether people are actually carrying out the protocols that they're required to. But I think there's a broader question as to whether those protocols are enough. Last week I had the privilege of being called as a witness to a select committee of the United Kingdom House of Commons, and on that panel there were experts from Singapore and Hong Kong, and it really brought home to me how much more rigorous their procedures are, even though they've got less to lose because they haven't yet eliminated COVID-19. But in Hong Kong, for example, everyone coming in is just Hong Kong citizens, rather like us. They are all tested at the airport. They wait at the airport until the result is received. If it's positive, they're taken straight to an isolation hospital. If it's negative, they have a mandatory 14-day quarantine.
So the Prime Minister today has said New Zealand's approach to the border has been extraordinarily cautious. With all respect, is she wrong in that view?
Well, it's ramped up, hasn't it, over time, and when one compares it with many other countries, like at the Select Committee last week hearing about the UK, I thought we've done pretty well. But this is absolutely vital for us. We've eliminated COVID-19. We've had a week of bliss, haven't we, with an end to social isolation, one of the very few countries in the world, people sitting in rugby stadiums, hugging and kissing, going to pubs and bars, and the economy starting to recover. We put that all at risk if we let people come in carrying the virus.
So how bad is it in your view?
Well, I'm not so worried about these two women because we know who their contacts are, and I gather 320 people are going to be followed up. But what really worries me is that we're told that there were 196 other people who've recently had compassionate leave from quarantine. It's as if the system's gone from, you remember a few weeks ago there was a case involving a legal family where the ministry were regarded as having been too strict. We've seen it gone to the other extreme. And I'd like to know, out of those 196 people, how many others were released into the community without being tested?
Are we getting sloppy and complacent, Sir David?
Well, I mean, it's a crucial question because...
What's your feeling?
I think we need to raise our game.
Do you think, obviously, exemptions on compassionate grounds have been suspended in the meantime, is the risk of allowing people out to visit sick relatives and terminally ill relatives, is it worth it?
Well, there's always a risk because I think it's important for us all to remember a single negative test does not rule out infection. People may be negative several days and then positive the next day and infectious. I don't believe that one could say that there should be no grounds for compassionate leave, but there has to be a very strict protocol. And I understand that some time ago there was a protocol that people would never be released within 7 days, and they would have to have a negative test. It'd be better still if they were tested when they arrived and then again at 7 days. But obviously that protocol was not followed in this case, and I'd like to know how many other cases like that are included among those 196.
Aside from the testing regime, what requirements would you need to be met to feel happy about someone exiting managed isolation early?
Well, I would never feel happy about it, actually, Lisa. I think, the only really safe procedure is the 14-day quarantine. But I think there will be cases where there's a compelling reason to make an exception. But I think it's essential that those people aren't allowed to leave in the first few days. I think to wait for 7 days and then to have a negative test is a minimal requirement. And then, of course, there have to be all sorts of procedures to ensure that those people don't come into contact with others unnecessarily. So obviously, we now have no limits on the size of funerals or tangihanga. I don't think they should be allowed to go to a funeral with 150 other people.
Appreciate your time this evening. That's Otago University Professor Sir David Skegg.